You're listening to the Public Health Epidemiology Careers Podcast, episode 130.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. Now, in this episode, I will address one of the most commonly asked and difficult to answer questions regarding public health consulting and entrepreneurship. Phrased any number of ways, people want to know how to get started. How do I become a consultant? Now, I'm going to attempt to answer a few questions that were submitted by members of my community, which will help address this question. It is a very difficult question to answer, and I think once I explain through, you'll understand much better. Now, I sent this survey out to my community and received these questions from my community, so I'm going to be reading directly from the questions that were submitted. After that, I will share some resources with you that you can follow up on. All right, before we get started, I really want to share something with you. Now, over the last year, about the last year or so, I've noticed several of my more senior colleagues, those that have been in healthcare and public health for many years, make an interesting observation. They talk about how sad it is that we are repeatedly addressing some of the most challenging and long-standing public health issues using the same old strategies and tactics used for many years. Very true. We have not reviewed, revised, or refreshed these old approaches, but rather continue the same old patterns and wonder why we are still dealing with some of the same problems. I say we as public health overall industry. Now, my colleagues made these statements with the sound of heartbreak, frustration, and defeat in their voices. One of the reasons I get so excited about entrepreneurship in public health is because it feels like the lights are being turned on. I believe that people who are inspired with ideas about how we can improve public health and advance the mission in a new way should be encouraged to do so. These very people with the ideas and the energy and the passion to serve communities and causes that they care most about should be encouraged to pursue these ideas and develop these businesses. Now, I'm proud to use this platform of the Expo to highlight the ways that my colleagues are creatively addressing some of the public health challenges in their own unique ways. All of us hope to inspire others with the ideas that we have, and to inspire you to take action, I should say, on the ideas that you have, to really move that forward. So let's unapologetically be excited about the way we do business in public health. Let's shake things up and advance the mission of public health with fresh, new enthusiasm. Are you with me? All right, let's do this. Now, in episode 129, the episode immediately before this one, I announced the Public Health Consulting and Entrepreneurship Expo is back, and it is better than ever. Make sure that you listen to that episode to hear all of the details. As we get closer to the expo, many questions have been coming up. Not surprisingly, one of the most commonly asked questions is centered around how to get started. It is no surprise because they're the very same questions that dominated our previous expos as well, both of them last year. Those questions dominated both of the expos. So I'm going to start with some of the questions that were recently asked of me by members of my community in response to one of my surveys. And I am going to literally just pull up those questions and read from them. I narrowed this down to 5 questions that I would like to address here on the podcast and on this episode. And I think that it will really maybe shed some light, especially as we go into the expo. So one question submitted is, what type of consulting is there? In other words, mental health, maternal health, etc. And what type of experience is needed to get started? So to answer that question, I really want to kind of explain consulting. When you are in consulting or you're a consultant, you are a problem solver. You are providing a solution to a problem. So sort of by definition, you're either going to provide that solution by way of doing whatever is needed for the client, or you're going to show them how to do something. So you're either going to solve it by doing it for them or showing them how to do it. And you have to figure out what that problem is. So just with that in mind, you're not limited. There are unlimited ways you can approach consulting, but you're approaching it from the standpoint of a problem solver. So as far as experience needed, the experience needed is a level of expertise in solving the problem. So figure out what that problem is, who you target, what the problem is, and how you can solve it in your unique way. Not to be vague, that's actually rather specific. Let me move to the next question. She says, thank you for this opportunity, he or she, I'm not sure which. How can I get into the field that focuses on cancer or radiation epidemiology? Great question. But first thing you need to do is really explore what is being done right now. Think about if you have a population in mind, if it's just cancer or radiation epidemiology, look and explore what's being done now. Ask yourself the question, how could this be improved? What's missing? What's not being done? How can I fill the gap here? First, find the gap, and how can I address this gap? Either in, access to services or lack of a product or improvement upon a product that exists. You have to first do some exploration and figure out what the problem is, and then you can how you can solve the problem. And essentially, that's what you're going to do. You don't know if it's product, services, improvements, development, creation, but you have to look around the topic that you're interested in. In this case, cancer and radiation epidemiology. Explore it and find out what exists, and then examine what exists and look for ways to improve or to fill a gap. Basically, is what you're trying to do. Another question here this is a third question. What aspect of public health is consultant work? What is the product? And I like this question because they're genuinely trying to figure out what is a consultant? What is this whole consultant thing that we're talking about? And again, you are providing a solution to a problem. It could be a product, and that product could be a digital course, or it could be a report, or it could be an app. It could be a physical product, like a physical device or an object, or it could be a service, like a training or coaching. So it can come in all sorts of, shapes and sizes, and can be manifested in any number of ways. And to whatever degree that you're either providing that service, doing it for the client or showing them how to do it would really define your product. Let me give you an example. Let's say as a consultant, you may provide a service to an organization. Perhaps they need a report, an epidemiology report to be written. So they could do it in-house with their staff, or maybe they don't have the staff that has either the capabilities of doing that, the expertise, the understanding, or maybe they have the staff that could do it, but they're doing other things and they consult with you to come in and do that report. So your consulting services will be to provide that report. So you're doing it for them. They don't want you to show them how to do it. They just want you to do it for them. So that's one example. The product is the report. Perhaps that same company, they want you to come in and show their staff how to put together these reports so that in the future they can do it themselves. So they may consult with you to provide training for their employees so that you can teach them how to do these reports. And so then the product is going to be your training. So those are just some basic examples, but I hope that helps to answer the question and to also emphasize what I mean by you're either teaching them how to do something or you're doing it for them. You're solving a problem either way, because the problem in either case is they need those reports. Either they want you to do it for them, or they want you to show them how to do it. So another question is how to pitch to health departments or other entities. This is a great question because this comes up often, But, my answer is first things first. Become really clear about what the problem is that you solve, who you serve, your target audience and population. And then you can have a conversation with the health department and determine if the problem you address is the same problem that they actually have. It becomes a conversation. So pitching to them can only happen once you become clear about what problems you serve and how, and if that company's problem, the company being the health department in this case, if the problem that they have is one that you can solve, then it's a conversation about how you can solve the problem that they have. That's how you essentially are pitching to the health department. But it doesn't start from how do I pitch them? It starts with the problem solving aspect of it and getting really clear up front about, because you may be able to solve a problem and you target a particular type of problem and a certain type of audience, and that might not be the same problem that the health department has. So it doesn't matter how long or how often you pitch to them. It's irrelevant if the problem that you solve is not their problem. So it ultimately becomes a conversation in terms of how you pitch to them. And the last question I have here on this list is, in terms of the ones that I'm addressing on this episode, what are the types of services that a public health professional could offer as a consultant? Love this question because I really believe there is unlimited potential. Going back to the definition of a consultant. And if you think about the sheer nature of how broad public health is, there is unlimited potential because there are so many different problems that exist in public health. So finding the population, you guys have heard me over and over and over talk about gaining clarity on the, what you care about, who you want to serve, how you want to address a problem, why you care so much. That helps you regardless of whether you're looking for a job or you're starting a business. You have to gain clarity there. So being clear on that first then leads you to the next step of exploration and finding out, where the gap is, where the problem is, how you can address it. And then you can address it in any number of ways as a consultant. And you're going to see in the expo so many examples of, how people are doing that. So those are some questions that I filtered out that I wanted to address on this podcast to kind of help, first of all, help you to understand consulting and what that looks like, because a lot of the questions that people are asking are really coming around not really sure what that means to be a consultant, and then helping you to understand also why it's very difficult to get just a cut and dry answer because it's not a cookie cutter field. We all approach this very differently. So how you start and what you need to do first and next and all of that really depends on you. It's a very unique strategy that you put together. Okay, so let me share a sample of a few more questions. These are the kinds of questions that reflect the majority of what I received in the survey. And I'm just going to read them together because my answer, my response is kind of a collective one. So here are some of the questions. How did you get started in consulting? Another question. Let's see. I have an interest in end-stage renal disease, and I've been wanting to know how I can start a business helping that population. I have a background in public health and social work. There are a whole lot of directions you can go with that. Another question. I would like to know how to get into public health entrepreneurship. I'm thinking about starting my own grant writing service, and I would like to know how to get started. Love that question. I love it when people are creative and they know what they want, and they're just, you can just almost hear the gears churning in their minds when I read these questions. Here's another one. I would like to know the proper tools I need to start. Here's another question. How do you land your first contract, set rates, do marketing? Great questions. Here's another one. How to even get started developing a niche and a clientele. And the last question, how do I start up? And the reason I read them all together and I smile, I'm not chuckling, I smile because I get these questions all the time. Last year, we were, like I said, we did the expo both times last year. We were bombarded with these questions. My co-hosts that were with me last year know what I'm talking about. We were really shocked at how much interest existed in our community for consulting and entrepreneurship. So that was a great, it was great for us to identify this problem and this knowing that the community, our colleagues are so interested. So here's what I have to say about that. It is very difficult. There is no one size fits all, and there's no one answer that, one liner that could answer those questions. There's no way for me to just directly answer these questions without having a conversation, because it really it's determined by so many different factors, where you are, what your needs are, and really truly the root of the questions that where you're coming from, because some people are just curious and other people are really ready to get started. So as difficult as they are, I will say that a few things, if I had to kind of narrow it down to some steps for you, the first thing you need to do is to really be clear on the problem that you aim to solve and who you want to target. My response in terms of how do you get started? Start there. What is the problem that you want to solve? And who are you targeting? Being clear in that. And then the next thing is to be clear on how you aim to solve the problem. And then lastly, from this point, you can determine your price, your marketing and so forth. I will use myself here as in an example. The problem that I solve with this podcast and with my community here is I help public health professionals, students, graduates, professionals to get the careers, get into the career field or start businesses that target the causes and passions and populations of people that they care most about in public health. Now, I do that with a number of ways. I teach strategies. I teach them through programs that I have, a variety of programs that I have. And the strategies that I teach depend on what my client or my customer is looking for. So if I've got someone who is looking for that career move, they're not interested in the business, then we're going to focus on a certain set of strategies. And it's an exchange of question and answer and taking them through a process. If I've got a client in front of me who's all focused on starting a business, then we're focused on a different set of strategies. And even if I break that down, once I get to know that client, there are certain strategies they're going to need more attention on than others. And it will vary from person to person. So I know that I solve with my strategic approaches, and I teach these in a variety of ways, but I customize it sort of based on how my customer breaks down into these categories. But I'm real clear on that. And in part of the assessment process, part of the conversation, I can determine what I offer. When I move into other consulting services that I have when I'm talking to other businesses and maybe epidemiology services or podcast consulting services, I use a similar approach. I still have to assess what my customer needs are and what's the best strategic move to make and how can I best address it for them. And some of my epidemiology clients or my podcasting clients want me to do a service for them, provided just do that for them. They don't want me to teach them anything. And others want me to show them how to do something. So that it becomes a process, but I know clearly what problems I'm solving and who my target audiences are. And that hopefully gives you some answer. And I'll add to this, you do have to be patient because all of the answers aren't provided up front. The day that I decided to go into business, I was not clear on all of the problems that existed. It was not all laid out before me. I did not know exactly how I was going to be able to handle these problems. I started with one problem that I knew I wanted to be able to address. And I knew that my target population, who they were, because they were constantly coming to me. And from there, developing that and building a larger community over time, more problems surfaced that I was able to address, and it kind of progressed from there. You don't always have all of those answers for you up front. Hence, another reason why it's very difficult to answer the question about getting started. But you start with gaining clarity around the problem that you aim to solve. And it starts with the one problem. And you may only focus on that one problem your entire business, or you may start to develop strategies or answers to that one problem, but have multiple answers, multiple solutions to that one problem. So you have to start, but you don't always have all of the details laid out in front of you. You don't always know exactly how that looks once you start. Okay, hope that helps. I'm going to narrow some things down here into 3 categories that I think are really the best fit. I'm going to narrow this down. I want you to self-select and put yourself into one of these 3 categories, and then I can point you to the best solutions, the more specific resources to help you. Again, this is really important before we go into the expo. I think if you are listening to this before the expo, you're in a great situation because you're gaining clarity. You're kind of going into the expo with a different vision and focus, and I think you'll get so much more out of it as a result. So here are those 3 categories I'm talking about. People in this first category are just generally curious. You are just, casually exploring the idea of consulting, and you just want to see what others are doing. That's wonderful. I think the best resource for you is the expo, because the expo is going to help raise awareness of what your colleagues are doing and how they are using their creative approaches to advance public health. You'll hear their stories of why they got started and what they like about it and what challenges they face, and just look at what products and services they provide and how they're helping, like I said, advance public health. So if you're just genuinely curious and you just want to know what people are doing, and, you've thought about, consulting, but just more from a curiosity standpoint, the expo is the perfect solution. So sometimes the questions that I receive are just from people who are curious. They don't necessarily want to start their own business, but they're just curious to know what other consultants are really doing and what that really means. So that's the perfect resource. Attend the expo. Just enjoy the presentations, ask questions of the presenters if you have questions, but just enjoy the presentations and just take that in as FYI. And it's great for our industry to see what others are doing, especially for some of my colleagues, like I described earlier, my more senior colleagues that are frustrated with the same old way things have been done. I think it's really refreshing for someone like that to attend the expo and just feel excited about what others are doing, to hear about these newer approaches to advancing public health. So that's the first category. So people in the second category have been thinking about consulting and are interested, but just not sure if consulting is really right for them or not. They're just not really sure if it's a good fit for them, but they're kind of curious, a little more than just wanting to know what's going on, but they kind of want to know if it's for them or not. If you fit in this category, then I highly recommend the expo. Awesome starting point, right? Attend the expo. But in addition to that, I recommend an excellent program created by one of my colleagues, Leah Roman of Roman Public Health Consulting. Now, Leah was on episode 95. So if you have not listened to that, please go back and listen to episode 95. And I'm going to pull up a few notes and just kind of recap that really briefly here. The name of her program is Contemplating Consulting, a readiness guide to help public health consultants or public health professionals decide to hit the brakes or take the leap. It's an online course. It's appropriate for public health students, professionals, that are considering a career as an independent consultant. It is a self-paced course. She said it takes about 2 hours total to complete. It's an excellent course. It also has the benefit of being pre-approved for CHES and the CPH, Certified Public Health, as continuing education credit. So that's a benefit of her program. And it also includes a 10-page readiness assessment workbook that students can use to determine if they're ready to start a consulting business and identify areas of strengths and weaknesses. And Leah says that hearing from some of her students already, the workbook has been extremely helpful, and they like that it prompts them to identify specific action steps that they can take after completing the course. So if you are someone who's just trying to figure out if it's good for you or not, then I recommend that. I will link to this in the show notes so that you'll know. It's also in the show notes for episode 95, but I'll also link to it in the show notes for this episode, and I'll explain that a little in just a moment, how to get to it. But Leah offers a special discount for listeners of the podcast. So if you are interested in her course, taking her course, then I suggest you visit the show notes page because there's a code there that you can use to receive a discount. So that is an excellent resource. If you fit into that second category, you're thinking about consulting, you're wondering if you're a good fit, if you're ready to be a consultant or not, then that's a great option. And then the third category. If you're in the third category, you want to start a business. You have some idea of what you want to do, but you just don't know how to get started, and you need help putting together a strategy for that business, taking the ideas into action and, where to start without being, putting all your energy in the wrong places. Don't jump to marketing if you haven't figured out the solution to the problem and things like that. So if you are that person, you've passed the point of trying to decide if you want to do it or not, and you want to do it. You just want some help getting started so you're not flopping around out there for 3 or 4 years trying to figure it out. If that is you, you ready to take your ideas and make, those actual steps of your business, then I recommend, of course, the Expo. But my program, which is called How to Get Started with Public Health Consulting and Entrepreneurship, is the solution. And it was for that reason. Essentially, I've split off. If you are interested in a career, meaning you're looking for a job in public health, a career move, you want to work for an organization, that is one separate coaching program that you've often heard me talk about. But what I'm referring to now is for people who want to take their ideas and start their business. So How to Get Started in Public Health Consulting and Entrepreneurship is the name of that program. I will link to it in the show notes. You can also find it from my website. If you click on the strategy tab and scroll down to the bottom of that page, then you'll be able to find this program. All right. Lots of information and resources. I promised you answers. Those are the best ways that I can give you those. Those are the next step answers, because the next steps beyond what I've broadly described is really working with someone to help you fine tune some things in terms of getting started. So regardless of the category you fall into, the Expo is the excellent first choice on all of those categories. That's where you should start. I think it's the great place to start. The Expo is an online event where a select panel of public health consultants and entrepreneurs who are passionate about the needs that they address and the populations they serve all come together and share their businesses. Now you can see the full list of awesome presenters and also sign up for the Expo by visiting drchuntley.com. That's my website, and clicking on the Expo tab from the main menu. Now, for links to all of the programs and resources that I mentioned in this episode, visit the show notes page for this episode, which is episode 130. You can go to drchuntley.com, click on podcast from the main menu, and once you're there, navigate to episode 130. And you'll find the show notes page and links to all of the resources that I've covered earlier in this episode. I know I've covered a lot, and you can just find everything in that one place by visiting the show notes page for episode 130, which is this episode. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.